Hi guys, this is Dr. Andrew, and in today's video we're discussing not to be overly polite, not to be too empathetic, not to fake empathy, and not to be nice to your patients. Now, I know this seems a little odd because everyone says to be nice and empathetic, but in my preparation, in my journey of doing this AMC clinical, what I've observed is that there is a discrepancy between what is said and what we understand. By we, I mean IMGs. So, if you look at the Western culture, if you look at UK or Australia, whenever somebody tells you a bad news, the person sitting in front or the person hearing would naturally say, I'm sorry to hear that. Okay? And that is it. That is it. They don't go too deep into it. And that is a way of showing respect to the difficulty that they are in. Now, I've also been told as a candidate that be nice to your patients and be polite and be empathetic. But in my experience, what I learned was that I was being too nice. I was being too polite and I was being too empathetic. And that looked, number one, fake. And number two, it looked as if I'm begging the examiner to pass me. So I have passed both PLAB and AMC and have failed both PLAB and AMC once. So in the exams that I passed, what I noticed was that I wasn't being nice. I wasn't being too polite and I wasn't being too empathetic. I was being naturally I was saying things that I would naturally say when somebody told me that they have a headache. Or I would I would say things that I would naturally say when somebody told me that their mother died of cancer. But in the exams that I failed, I had a lot of focus on saying things like, oh my god, I'm so sorry, you must be going through a very difficult phase. I cannot imagine what you're going through. In the exams that I failed, I did this and I did a lot of it. When I came out of the exam, I thought I nailed it. They would not find a nicer doctor. But but now I understand they don't want nice doctors, they want competent doctors. And so our aim as IMGs is to tell them that we are competent. Yes, we can be warm, but we cannot compromise warmth on competence. What I mean is, you can be competent doctor and that will get you to pass. But if you are warm, if you are nice, and if you are polite, that will not get you to pass if you're not competent. And in my experience, if you are very competent, if you have worked really hard and you know everything, you naturally tend to not be nice. I've noticed it. The exams that I wasn't well prepared, I would try to compensate it by saying extra thank yous and please and sorry. And I would even beg the patient. I mean, there are certain cases in the handbook where the patient refuses the treatment, and I would feel it's my responsibility to get them the treatment. See, that was how nice I thought that I had to be, that I have to influence them, I have to please them, and I have to get them to take the medication. That is my responsibility as a doctor. No, my responsibility is to tell them this is the pros, this is the cons, and you have the right to decide. You want to decide for the treatment, go ahead, this is what will happen. You want to decide to refuse the treatment, go ahead, this is what will happen. And as simple as that. I did not have to pursue them, I did not have to apologize them, and I did not have to validate them that whatever you're doing is nice and you have all the rights to do that. No, there's no need. So the concept of this video is that, number one, don't be overly nice and empathetic to your patients. Do what comes natural. Do what you would normally do in a normal conversation. So now I understand that there is some cultural differences between IMGs and the Western population or the Western culture. But overdoing it would definitely get you to be downmarked. At least it got me to downmarked. I'll give you another example. I was in a GP clinic and I was doing observership and I was asked to examine a patient. I was asked to do a respiratory examination. I examined the patient and I thought that I have tick box everything from teleoponer, and I thought the consultant will be so impressed. When the patient went, the consultant came to me and he said, Andrew, you did good, but it seems I'm talking to a student and not a doctor. And I actually thought about it. I think the reason he said that was I wasn't examining the patient. I was trying to impress the examiner, number one. I was trying to be nice to the patient, number two. I was trying to pass the exam, and by trying, I mean I was begging to pass the exam. So I think we IMGs tend to be overly nice in our OSCE exams because we worked so hard. because we have given so much, because a lot is at stake, and now we want to pass. And that desperation comes out as being overly nice. But if you think about it, if I really respected my own hard work, I would not ask them to pass me. I would say, this is the skills that I bring. If that crosses the bar for the AMC clinical, good, pass me. If that does not, it's okay. So what I feel is, if being if being nice, let's say if being nice and being warm comes natural to you, go ahead, good. But don't push it. Don't make it look like you're putting an effort on it, because then there's no point in being empathetic, right? The whole concept is to be nice. But again, like I said, competency will get you to pass. Niceness will get you to be scored a little more. I hope this helps you.